prepared an op-ed that's available. You should have them at your seats. And I want to call your attention to that. And this is really in support of Senate Bills 2 and 3. Senate Bill 2 is the Building, Homes, and Jobs Act, and it will generate about $230 million to $260 million annually at a maximum $75 fee on real estate transactions, and that excludes home sales. So it has the potential to generate a lot of money for housing. The other is SB 3, the Affordable Housing Bond Act of 2018, and this would provide voters an opportunity next year, not this year, to decide whether to approve $3 billion in bond financing. Both of these measures are going to be considered by the Assembly as they reconvene here in the near future. And if passed, these would be able to be leveraged with local dollars to accelerate development of low-income, affordable housing in our region. The three of us feel pretty strongly that this could be a big help to not only our situation, statewide situation, and we need to figure out how not only to do this, but how to address the regulatory barriers that seem to be in the way of developing housing. So we've got other things that need to be done, but it's a topic that I wanted to make you aware of and mention to you. And you can look it over and see whether you agree with us or don't agree, but at least three of us felt pretty strongly about it. I appreciate Rick and Chris joining me, but it was a work of all three of us, I'll tell you that. You also may have noticed that I added my name to a list that is seeking to, private group, that's seeking to be able to locate some major structures that would provide some sheltering for some of the people out in the streets. And it's estimated it could be upwards of 500 people that could be affected in a positive way. I don't want anybody to feel that this is diverting us from our Housing First effort, which is going to take longer while we're waiting. I'd hate to see people continue to be through another winter without doing our best efforts to get more people off the streets. And we simply don't have a massive solution. So we're working through that and chosen to become involved with them. There's a lot to be decided. The county and the city are working together on how these structures, how they could be handled in a way that not just warehousing people, but we're providing services and other things, and referring people to the services that they need to be at, so that even in a temporary housing situation, we can be handling these individuals in a professional way. So there's good cooperation going. We're all working together on this, and I'm hopeful that as the limitations are being discussed, we're able to come to some agreement, which is largely a result of the city council deciding where workers would be located. But we're working on this. I'm very hopeful that we can see something happen before we get, to the end of this year. See some action on this. I think it's important, and I think it complements everything else. And by everything else, we've also been meeting with the Housing Commission. I mentioned earlier that the county has several different properties, and we've actually started to prioritize those and start to do the initial work. We're going to have some preliminary plans, at least schematic discussion type plans on how we might be able to start to move the first of those forward. So you're going to see some things happening, but I think are really positive. A lot of people are putting a lot of time behind the scenes. I'm really appreciative. And here nothing's happening. It's okay. Just be paying attention when it does happen. There are things happening. I just returned from Portland. I spent most of the day out there walking around in downtown, talking to people, seeing what was going on there, and seeing some of the distinct differences in how they handle issues to how we're doing things here. And we're a small city that's got a pretty significant issue to deal with too. So we're trying to tap all the better knowledge we can to bring it to bear here in San Diego, where this year's going to be different. Right, so in a lot of ways. With that, I want to go to the Vice Chair Ward to see if you have any comments he wants to make.
I do. Thank you, Chair Roberts. I wanted to give a couple of updates from City Hall. On July 24th, the City Council had a special meeting called our Housing Action Day. We were looking at the beginnings of a number of initiatives we're going to be taking over the coming 24 months to be able to reduce a lot of our requirements and help streamline some of the permitting and processing needs that we have to be able to deliver housing more effectively and more cost efficiently. And so a few of those were approved at the July 24th meeting. We saw a reduction in fees and processing times for companion units that are complementary to some of the state actions that were taken recently. And we also reformed and helped to improve the expedite process for affordable infill housing. That has not been able to produce, I think, some of the stated goals that the program was originally intended for when it was developed a number of years ago. So we do hope that we'll be able to meet those goals because, as you all know, time is money, and that is passed on to consumer. We want to try and build more affordable units, and to that end, in partnership with our Housing Commission, the following week, the City Council approved another 620 affordable units across 6 projects throughout the city, and they really are across the city. We have 203 units in Mission Valley, another 170 units in Encanto, units in Bankers Hill, Pacific Highlands Ranch, Southeast, and 2 more projects in southeastern San Diego. So we had a lot of action last month, and then at the Select Committee on the Homelessness, which I chair, we approved our work plan for the coming year that's going to cover a very aggressive schedule, a wide range of subject material that the city wants to dive a little deeper on, areas of land use, housing and public facilities, legislative actions and declarations, public financing, and other opportunities for us to make a better difference within the city of San Diego. I've got 3 excellent colleagues that are with me to, I think, really have some full and exciting meetings for those that are interested in these topics, and I hope that you all will be able to attend. The next meeting that we'll be having is on September 13th at 9 a.m. We also approved in concept some recommendations that I had put forward that begin to start to encourage the city and our mayor to look at specific opportunities around Golden Hall, around the practice field at Qualcomm Stadium, around safe parking zones, care zone opportunities, some other new and creative models that are using in other jurisdictions. We had to welcome, and I want to welcome here, the Mayor's Senior Advisor on Homelessness, Jonathan Herrera, who is advanced and who is already excelling in this role. Thank you, Jonathan, for all your work this past month on areas of homelessness. And along with Jonathan and my colleague, Georgette Gomez, we were able to travel to Seattle with Rick Gentry and others to be able to explore some of the tiny homes and other creative temporary housing and bridge housing opportunities that they're doing there. And I'm sorry that I missed you, Chair, because I also was in Portland on that trip looking at some of the facilities that they have been able to open, because one thing I learned from those 2 cities is that we're not alone in this challenge, that certainly as West Coast cities we have are, I think, very strong challenges here trying to assist and help and manage the impacts around homelessness and those who are experiencing homelessness. So that was very helpful for me to see over the last week. And then I also want to really quick acknowledge we've got another partner at the city that's really stepped up out of our city attorney's office. Mara Elliott has asked Deputy City Attorney Keely Halsey to really have play a more proactive role in helping us with our homelessness efforts. And so Keely, I wanted to thank you. She's standing up in the salmon-colored, orange-colored shirt back there for all of your work and for being here at the RTFH as well. So thank you.
Okay. Moving along, does our secretary have any comments, Karen?
I do. Board members, we are looking for volunteers for the Appeals Committee. Anyone who is not applying for HUD funding, we need 3 board members. This is actually a great opportunity to get involved because it's a very short timeline. It'll be right the first week of September. The appeals will be heard on September 8th. That's the plan right now. And so typically you'll need a few hours beforehand to read everything. The meeting is very interesting. It's very important. and maybe a few hours the next couple of days after that. So we need three people. Thank you, John. If you've done it before, maybe you can do it again. Seriously? Okay. Excellent. The head of the scoring committee told me we had a wonderful appeals committee last year, so you were on it. We need one more. Ray, thank you very much. If another board member thinks about it and decides you have time and like to, we're happy to have more. So just let me know. Thank you so much, all three of you.
And thank you all for volunteering, quote unquote. No, you'll do an excellent job. Then those items, we did have one action item. Did you have comments?
I wanted to make one statement today. We have now sent out, as at the beginning of phase 2, request for data. Those of you who are involved with the HMIS system, this is part of the study that Focus Strategies is conducting. You will have received either today or yesterday, possibly, a letter signed by Supervisor Roberts and myself letting you know the status of this, that we're requesting data so that we can do it. This has gone out to 66 different agencies, 14 of which have seats on the board. So that was mailed out. This will be followed up by another very specific request for data. Your help and cooperation will be greatly appreciated because it allows us to really do, the more data that we get, the better the data significance of it. So we appreciate your support, and that will be ongoing. Thank you.
If you didn't get one of these, let us know. We don't want to miss anybody. We want everybody to be aware of what we're doing and what's needed. Yeah.
I just have a question, Mr. Chair. You had mentioned the 500 new beds, which is very exciting. I just wonder if it's appropriate if this group might want to discuss that a little bit, perhaps talk about how it fits into the community plan, how does it fit into the overall strategy that we're doing.
Why don't we include that on one of our next agendas?
Yeah.
Okay. And we'll prepare a report and so we can fully brief you and bring you up to date on what might have happened between then and now, because it's not just in play, it's sort of significant, I think, in terms of the proposal. So yeah, we will make sure that we calendar that. Okay. Okay.
A question on the request for data. It came out in a hard copy. Will we be getting electronic requests in terms of filling out a form or anything like that? How's that going to work?
I believe that the follow-up request will be coming electronically. Because we needed signatures, we chose to do it this way, so that you knew that we actually cared.
Which means we're watching. But most importantly, if you didn't get one, let us know. You can connect with Mr. Walker, and but we need to, I need you to be aware in what you're doing and how you're going to need to participate. Okay? Okay, with that, I'm going to move on to what was our scheduled action item number 5, which is the presentation and approval of phase 1 of the community plan framework. We're going to have the report. We just won't be able to approve at this meeting, and I can guarantee you this will be on the next agenda. Okay, Greg?
Great, thank you, Chair. We'll direct everyone to page 7 of your board packet. It includes the staff report for this item. Those of you who are on the board also received an electronic copy of the community plan earlier this month, along with a report from the RTFH Community Plan Ad Hoc Committee. We were initially asking you all today to formally approve receiving and accepting this report. I'm going to ask that you still receive, accept, and get ready to move forward with action, and we will formally codify that at our meeting next month. I'm going to give a brief report and then turn it over to this group for questions. We have an ad hoc committee that met several times over the course of this year to oversee this report. It was drafted by the consultants that the RTFH hired, Focus Strategies. While it was drafted by our consultants, I want our board to fully understand this is our plan. This is our community's plan. It was drafted with our input. It was created with our input. It included 45 key stakeholder interviews with different regional leaders. It included 9 regional meetings, several meetings of the ad hoc committee, which includes representatives from many of the service providers here in the room, the funders, the county, the city of San Diego, probation, several others. And it's data informed. If you took the time, and I hope you did, to review not just the plan, but the appendices, you can see that it lays out where we are now with a pretty stunning array of services and programs and initiatives, and where we need to go. And that is to have a singular coordinated homeless crisis response system, rather than an array of separate programs. The summary of this, if you see in the report or the plan, there are 5 key areas that we need to take action on. We need unified leadership, number 1. I think we can all agree this group has the opportunity to do that, and in many ways is already moving forward there. But we also need to acknowledge there's much work to be done. Number 2, system access and entry. This is all about outreaching to people in effective ways, connecting them to right-sized services. It's also about diversion. How do we get people out of the system if they don't need to receive the limited resources that we have? The third area is emergency responses to homelessness, need for places, Chair, to your point, for people to go who are on the streets right now, and how do we most effectively utilize those resources? Our coordinated entry system right now does not yet include all of our emergency shelter beds. We need to set a date for when that happens, and we need to do it. System exits. Where are people exiting these programs to? And how effectively are we monitoring that performance? And finally, the infrastructure, our systems infrastructure, to do all this, to track these outcomes, to track our progress, and to make improvements where they need to be made. So that's a really high-level overview of the plan. It is phase 1, and to Gordon's point, phase 2 is going to include the data from all of our providers in the region on not just how effectively we're exiting people into housing, but also looking at the cost to do so and how we can more effectively utilize the very limited resources that we have. So none of this is groundbreaking. I don't think anyone read this report and went, oh my goodness, I never saw any of that coming. Right? It includes a wealth of really helpful data. It includes very practical steps for implementation over the next 12 months. I would ask this group today to identify any red flags that you see, to ask any questions that you may have, because while we won't formally adopt the plan today, the action steps, the implementation steps are going to begin because we cannot wait any longer. The ad hoc committee reviewed this plan over the course of several meetings. We met last month and recommend to the board that it be approved. And we also asked that this board take a leadership role in identifying not just how we can better utilize the existing resources, which is so much of what this plan is about, but how we as a group can lead the community to bring online new resources, specifically the need for more housing stock, including affordable housing, the need for coordination among landlords of the limited amount of housing that we have, and the need for more supportive services. The ad hoc committee also asks that this board take up a leadership role in weighing in on different initiatives as they come forward. Perhaps one of the initiative that was mentioned earlier. What does this group think about it? To your point, Joel, how does it fit into our community plan? This needs to be the go-to venue for all of these things to be sorted out. And the ad hoc committee feels that the community plan really speaks to that this group has been seated for this reason. So think of it as phase 1 is where we need to go, the steps we need to take to get there, and then phase 2 is going to be exactly what we need, what we're going to look like when we do get there, and where some of the gaps are. So it's a very quick review. You all have had the materials for a little while now, so I'll turn it over to the group for any questions. Although before that, Gordon, do you have any comments or anything else you wanted to say?
I think that you've done a good job. We, as a staff, we are looking at this and we are moving to begin the implementation. Not that it was begun before I came, and we will continue on with that.
Questions or comments from the group? John?
It's just brief, but I'm seeing little or no input from the homeless, which is sort of like saying this is a plan to deal, we're the Bureau of Indian Affairs and we're dealing with Native Americans, but we're not allowing the Native Americans to speak, and none of us are Native Americans, you see. And I'm suggesting that getting the cooperation of the homeless is key, and getting the input of the homeless is key, and you could do a lot more stuff with a lot less trouble if you did it that way. That's all.
I couldn't agree with you more, John, that the input of our neighbors experiencing homelessness is absolutely vital and critical. We cannot do any of this without working with the people who are experiencing it firsthand. We had a member of our ad hoc committee who is experiencing homelessness, and we held 9 different community meetings, several of which included individuals who brought that perspective and that lived experience. But we can always do more, and I will pledge to you personally and professionally that I'll work with the staff at the Regional Task Force to make sure as this is implemented, because it is a plan, that we continue to hold these educational sessions and hear the voices that are most important. I don't know if you would add anything else to that, Gordon. Thank you.
So another hand? Okay.
Thank you for doing this, and thank you for the team reaching out to all the providers and the participants around the table. And we have some service providers throughout our county, mostly in not San Diego City, but in our county, that are helping people end their homelessness and are part of the system, but they're not playing in the sandbox. They're in the park and they're helping, but they're not in the Housing First sandbox. And I'm a little concerned that with a plan that is so particularly focused on Housing First, even though these providers may or may not participate in HMIS, I know we had some challenges with the point time count with one of these agencies. It's if we're pushing out the agencies that are not Housing First, that have a very significant sobriety component to them, they're not part of our system, and therefore we're not able to say all of San Diego is counted as this. And so, and I do kind of speak for the Salvation Army. I have one very strong program that is Housing First, and I have another that is not. And one gets government funding, one does not. But they both are helping to end homelessness. And I think there needs to be room in the playground, or acknowledging that someone's on the swings and they're playing on the swings and they're doing a great job, but they're just not in our sandbox. And so I think we need to look at it as the whole system, not just our coveted sandbox. And I know the dollars are in the sandbox, and if we want the dollars, we've got to play in the sandbox. Those are the rules of the sandbox. But there's a park. Okay, I'm done. Sorry. I've been with kids too many days.
Jessica, thank you for your comments. I think that the position of the RTFH certainly is that we are interested in the Housing First model. I personally feel that anyone in the sandbox or in the park is playing an important role. Those who receive federal dollars are required to be in HMIS. Those who do not receive federal dollars are invited to participate in HMIS. In fact, we will be doing everything that we possibly can to reach out to all agencies to ask them to participate with us. Whether the funds are singular or multiple area, which I'm sure you understand, we need the data of all, because it is a system. I personally understand very strongly that everyone plays a role and that all of the programs are very important. We do have a focus on federal funding. That's not our only focus. So please be assured that all are invited.
Yeah, I think we made the earlier comments regarding the temporary structures. Clearly, that's not in line with a lot of things we want to do. We're not going to throw that out. But what we need is the cooperation and participation. Okay, that's different from not necessarily having the program that stresses the housing first. Okay, we want to get those people who are kind of on the outside. Some of them have not been able, they didn't have the technical skills maybe to do the things we want them to do. We got to get to a no excuses base so we have a better system here rather than people operating on, in an hinterland without our knowledge. Okay.
Jessica, to your point, and I think I know the area you're speaking about. I think for a future agenda item, for example, when we talk about the downtown 500, if you will, it would be good for us to begin to develop some articulated positions on how we begin to outreach to certain areas. If she's talking about the area I'm thinking of, it's a pretty big area, and it's one that does represent significant homelessness, and they definitely would require a different kind of approach, a different language, if we wanted to bring them into the sandbox and or provide them with the technical skills and assistance that would allow them to begin the path. So, we could make her concern part of our future agenda.
It's possible, because like I said, I'm kind of bossy, so I tell the staff they have to do it even though they're not getting government funding. But it's possible so y'all get the data from our programs that aren't government funded, and then participate in CES, or they're trying to at least. So I think there's capacity, but I'm just concerned that the framework, and I voted for the community standards, don't get me wrong, I voted for it. I'm just concerned that some of our language is all or nothing. And I think it needs to be all or nothing for the sandbox, but not necessarily to end homelessness.
That's right.
Okay, thank you.
I hope that's crystal clear. I'm as confused as anybody right now, but that's okay. I feel like we're talking in codes, and we'll get there. I mean, let's look at the plan and then tell me specifically if you have problems with the language and how it should be expressed if it's not clear. But we've got to have a clarity here, and we have to have some expectations, and we have to have some goals that are going to be reachable. So we'll get there. Okay. Who else? Go ahead, John.
I know I was on the ad hoc committee and I actually brought this question up before, but maybe for the whole public, it would be good to address this. Typically when you have a plan, it's attached with a budget. So when we talk about phase one, are we talking about using existing resources and programs to implement phase one, or where does the dollars or budget come in?
That's a very good question. First of all, I tell you the dollars are going to be there. We will have the dollars to go ahead with phase two, one way or another. We're going to have those dollars. And we're going to get them in a number of different ways. Chris and I are involved with doing some fundraising. But, we're doing things outside of the budget, but the budget's going to be there and it's going to be balanced. And by the end of the year, we'll have accomplished all these things. But we're going to be able to go into that phase.
But I think also just resources, like we need to add X number of permanent supportive housing units, things like that. Is that, does the plan address that?
At this point, and actually, Greg, why don't, may I?
Greg, you got it.
Yeah, so the plan only calls out in broad strokes what the needs are. Talks about a need for more rapid rehousing as one example, and it gives an example of how to approach private community to do that. Phase two will provide the specifics of exactly how many units of permanent supportive housing we need. And in order to do that, we need the data from all of the existing providers. That's the letter that was referenced earlier. I do, though, agree with you that we need to bring forward to this board continued updates on the implementation. Because you asked about implementation. I took your question to mean, what's the budget for implementing this plan? Not necessarily the plan for paying for the creation of the plan. Because the plan's great, but it doesn't really matter if it's not effectively implemented. So I will look to staff and our board leadership to figure out how exactly we're going to go about implementing all of the action steps in here. Because those may require additional resources.
Absolutely, it will require additional resources. And as we identify the direction and the plan itself, we will then work to identify additional resources. We will begin now knowing that we need additional resources. We have some experience in this type of plan, and so we know what generally is going to need, not the exact plan that will come, but we are beginning to identify and work on identifying resources at this moment that may take a while to generate. But we understand the plan is going to call for additional funding, and we will be working to develop and bring into play additional funding so that we can implement the plan.
Yeah, there clearly are things going on right now that will be merged into the plan. But we're not going to stop and take this in a sequential way. I think, I think as we go into the year, you're going to see better. We may not have answers to everything, but you're going to see a significant inventory of things that are coming, along with the funding for those. And that's part of the work I mentioned earlier. We've got some options. Walter?
Yeah, I first want to acknowledge the ad hoc committee and focus strategies for the development of the framework. And I said this in the ad hoc committee and to focus strategies. I know there was, in looking at the plan, there was a minimal attention paid to the youth homeless issue. And I just wanted to say that that's something we need to really focus on as moving forward. We had, as you remember from the point in time count of the 9,000 individuals, almost 1,200 of those individuals were youth. So it's something we really need to make sure we pay attention to. We do have a youth subcommittee under this RTFH. I'm now a co-chair of that committee. We'll use this framework as we're bringing forth recommendations around some of the unique features around homeless youth issues. So appreciate having the framework to work from. We'll make sure that we can integrate and coordinate our efforts and any recommendations that come up from that committee. We actually had 3 different dispersed groups working on youth homelessness. We brought them all together to work so that we're all rowing in the same direction. And I think that's going to be really important. And to the point that Jessica made, a lot of the resources, a lot of the funding that currently is utilized to address homeless youth are not through the federal government, not through the HUD system. So a lot of that is, I think, missing. So we want to make sure we bring that into this. And I think that's my role. I think here on the board, I'm a youth provider, and that's what I'll be doing.
I noticed in the plan, it's a very good plan, by the way. I noticed in there that there was some language regarding performance-based contracting, and I think a move towards that would be great. I just want to make sure that when we're talking about performance-based contracts, that we are comparing apples to apples and not comparing programs that perhaps provide just a light touch to homeless individuals to programs that really work with a very challenging population. Then I think the performance would not be comparable. And so I just want to make sure that we pay attention to that as we move forward with this process.
Good point.
So I had submitted some suggestions earlier. I think I might have missed the due date. But I do think that there are opportunities for us under unified leadership to talk about being able to change public opinion about homelessness. We're doing a lot of good work and we're not kind of getting it out. Like, I forget who it was that said something about nobody outside of this group really knows what's happening. So how are we changing public opinion? Also, under the system access, and a little bit to your point, Jessica, with regard to the others that are in the park, we still need them to submit data that's timely, that's accurate, that's real time if we get there, and that's kind of not identified in here. I also had a couple of other comments and also wanted to acknowledge that in the section where we talk about what's in place, we start with about the first part of this year when we got you guys onto the leadership team, and nothing in the past. And I think there's been a lot of strong, good work that had happened in the past that's not acknowledged in this plan and what's in place. And I just think that we ought to hold on to the historical efforts that we've made over time. So there were a few other comments, but I did submit that in writing before.
Okay, thank you. Any other comments?
Good afternoon. I would just like to share, we had our first ever countywide law enforcement only meeting last week to talk about our role in this gigantic issue. And we, as a group, the Sheriff's Department, the PD, there are several PDs from across the county, and what we're eagerly hoping is that there's going to be an ability to adopt a countywide protocol on enforcement. You know, we talk about the PD, about compassionate enforcement. That's a big discussion item in the news with advocates pro and against. But as a county, we need to, the law enforcement side, I think we need to play a bigger role in making sure that whatever these resources are, that we have the ability to tap into them at 3 o'clock in the morning. Because that's the stuff where we collectively as a group, the frustration we feel is that we're the 724 provider in some ways. We are not a service provider, but we are the contact, and we need to figure out a way to get more connected with the resources. In addition to that, we have discussed our ability to collect data as an entire region on the encounters we have and the types of individuals we are working with. And hopefully, as these programs develop, there will be ways that the encounter on the street doesn't result in a trip to jail, then a trip to a program, but actually straight to a program.
Well, I think that's in keeping with what we're trying to do, clearly, no question about it, is to be able to have the information so you've got that at your fingertips, so it's 3 in the morning or 10 at night or 8 in the morning. So, and I think I think we can do a far better job as we get everybody working together here.
Supervisor,
thank you.
Sorry. One other thing that Charles just reminded me of, and that is that I think in our plan and necessary to HUD's requirement, we do have to address something about the criminalization of homelessness or the avoidance of that. And I hear from law enforcement that's what they want to do as well. But we do need to acknowledge it in our plan and not get dinged on that in terms of points from HUD contracting.
And I would say that was raised by members of the committee and does still need to be addressed.
Okay. Any other comments? I do want to give a special thank you to all the people who have served on the ad hoc committee and to Greg for his leadership on this.
Well, I'd actually like to thank Rick Gentry and specifically Melissa Peterman from the Housing Commission for staffing this in the beginning. The leadership of the staff of our executive board as well, and then, as Walter said, kudos to Focus Strategies who did a lot of the work here.
Okay. If there are no further comments, again, this will be brought back to us for another discussion and approval at the next meeting. So stay tuned. With that, we're going to move on into the informational items, and we have an update on hepatitis A. Dr. Sale is here. Here he is.
Hi, good afternoon. Thank you, Chair. And thank you, everyone. I appreciate you all allowing me to give you an update on the current outbreak. I think most of you are familiar that we are undergoing an ongoing hepatitis A outbreak in this county, unfortunately. It is the second largest hepatitis A outbreak in the country since 1995 when the vaccine was introduced. Amanda, can you go to the next slide? Thank you. So this image speaks volumes and to the power of the vaccination strategy that that we're trying to achieve. And so you can see that, or you might not be able to see the numbers, but basically it goes from 1994 to 2017 of data of cases of hepatitis A in San Diego County. And you see that in the beginning there's higher volume of cases, and that volume dropped dramatically once the vaccine was introduced. In 1999, it became a routine childhood immunization recommendation. So those of you who might have had kids or nephews, nieces, they would have gotten that, if they're probably younger than 19 or so. And in 2006, it became a standard, routinely recommended vaccine across the country. And you see, it continued to drop, and then you see this huge spike in 2017 where we are. So I'll talk to that, and that includes all of our outbreak cases as well as some of our travel-related cases, which is the usual numbers that we get. You can see that usually we get about 15 to 40 cases a year, and mostly for the large part, travel related. They go to, and some of you might have gotten vaccinated when you went to another country, and I've gotten vaccinated when I took an international trip, and then a lot of people get it there and then come back here and get sick, and so the cases are counted here. The large majority are these due to this outbreak. And so what is hepatitis A? And we find that when we talk to a lot of the homeless, the drug-using individuals who are disproportionately affected, and the general public, a lot of people don't realize that this is different than hepatitis C, hepatitis B, and so this is also a virus, and it can easily spread from person to person. It can cause, liver infection, liver disease that usually lasts a few weeks. Some people can get it up as long as 6 months, and in rare cases, it can cause death. And what makes it challenging really to contain, next slide. What makes it challenging to contain this outbreak is that I can get infected today, and it can take up to 15 to 50 days, 50 days, for me to get symptoms, if I get symptoms. And on average, 28 days. So that's very challenging. What's not on that slide is that I can, if I get hepatitis, before I get symptoms, a week before I get symptoms, I can start spreading it. I can start shedding it. And then up to 2 weeks after my symptoms end. So, this is 2 weeks after the start of symptoms. So this is a hard, disease to contain, and the virus itself is pretty hardy. It can live outside for a couple months, depending on the environmental conditions. It can be killed by, really high heat, by using bleach solutions, things like that. And in the water supply, it's generally not there because we chlorinate our waters, right? And so this is another reason why vaccination is so important, because, and especially in the populations disproportionately affected with this outbreak, who may not have access to that sanitary, those hygienic conditions, it's more important to get them vaccinated. And it is a 2-dose series, but 1 dose is enough to help contain the outbreak. 1 dose will give us 88% effectiveness. Next slide. And so it's spread, it's called what we call as a fecal oral disease, and so you just need to ingest a little bit of fecal matter in microscopic amounts to possibly get infected, right? And I know that sounds, sounds disgusting, but I know it sounds unreasonable, or none of us, how could that happen? And people know what they're eating, but I don't know, you've all seen those studies on cell phones when they swab them, and people see fecal matter in some of those. So it is within the realm of possibility, and there are different ways that you can get it. But you can either touch something that has hepatitis A and then not wash your hands before you ingest it. Some outbreaks have been due to kind of contaminated food. You might have heard of the Costco strawberry or berries, frozen berries, a couple years ago, and that was an outbreak from contaminated food. And then here, though, in this outbreak, it's what makes it different and even more challenging. It's really that close person-to-person contact. It's really that the contamination in the environment that's helping to spread this, right? And so, and we know also that it can be spread by sharing things, by sharing drugs, and sexual contact. And this gives you perspective of the largest outbreaks on the top since 1995. You see that we are number 2 now. We have 333 cases. We have 70% hospitalization rate, and then we've already had 11 deaths. And what the importance of this slide shows is that there's different types of outbreaks. The most common way to get hepatitis A is through that close person-to-person contact, but in large outbreaks, and often these multi-state outbreaks, we usually see that it's a common source like food, something like that. So like the number 1 row right there from 2003 in Pennsylvania and Ohio was due to, was Chi-Chi's restaurant, and they had contaminated green onions, and they had 660 cases, but only 3 deaths, right? And so here we have 333 cases, half as many cases, but 11 deaths. And you see that us and Michigan, which is that fourth row over there, also has a high amount of deaths, and they also have close person-to-person contact, and it's also in these populations, but more in the drug-using population, probably more than the homeless. And so, why is that? For many reasons. One is that we know that the people who seek medical care for these populations, they seek medical care, they have a higher threshold to seek medical care. So we're probably not even seeing all the cases, and then we see the more severe cases. And then they have more underlying conditions in general. So the folks, the 11 that passed away, all of them have underlying medical conditions. And so, we worry about them, and we want to make sure that, for these vulnerable populations, that they are vaccinated. Okay. Next slide. And so here are the numbers again. As you see, I've already talked about the top two rows, but it is 2/3 in males. It is in 20 to 87-year-old age range, with the median really in that middle age group. Walter, you'd be happy to know that children, this speaks to the power of the vaccinations, that children are not affected. 20-year-old is the only one, and that 20-year-old is the only person who was vaccinated and got sick. Everyone else was not vaccinated, and the suspected exposure type is interesting, because when we look at who are these cases, we see that about 40%, 39% are homeless and drug users. We see that 16% are homeless only, 11% are drug users only, 23% are neither, I'll get back to that, and 11% are unknown. Unknown means that some of these individuals are discharged from the hospital or the community clinic where they get diagnosed, but then we don't get to interview them. We don't get their information. We don't get it reported to us in time, and so we can't go out and talk to them and find them afterwards. They're lost to follow-up. The good news is that we're working very closely with our medical institutions, our hospitals, and we're getting quicker reporting now than we've ever gotten. And so now we're trying to interview them as soon as they even suspect that it's hepatitis A and order the test to try to confirm it. We're out there, trying to call them when they're on the floors, in the ED or on the floors. And then the neither is interesting because, these are often, I think a lot of times in the media it's talked about a outbreak that's largely affecting the homeless and drug-using individuals, and that's true. But, a fifth of folks, or a little bit over a fifth, are neither of those. And so who are they? For the large majority of those are individuals who are working with those populations, which is exactly why we made this local recommendation that if your staff are working very closely and on an ongoing basis with these populations, they should also get vaccinated, because they're the next ring, they're the next concentric circle around the homeless and drug-using individuals who are most at risk. So, but there are some other people who are neither of those, not staff, not volunteers, not healthcare workers working with these populations, and there are some others who are just happen to be in the same locations, and we think they probably got it just from picking it up from the environment. We know we have certain cases of that where someone just works at a place where there's a bathroom that homeless people frequent, and then they ended up getting it even though they're not homeless or drug using, So, the next slide. And then the other interesting thing is about almost a quarter, 22% of individuals of our cases that we have lab results on have hepatitis C. So, and if you have hepatitis C or hepatitis B or cirrhosis, they should already be vaccinated. The provider recommendation is they should be vaccinated. But the unfortunate news is that in San Diego and across the country, we see like 8–10% of those individuals being vaccinated, even though it's an indication for that vaccination. Because once you have one insult to your liver, if you get another, you're more likely to have worse outcome, right? And then we have our kind of usual travel-related cases that are not included in here. That's the 19. And we have a lot of cases under investigation. We get about 3 to 5 a day of suspect cases that we end up working up. And it takes a while to go to the CDC, to confirm the lab, and come back and make it a confirmatory diagnosis. We are bringing that process in-house. We are working with the CDC to understand their technology, and so that we can process cases faster as well. So, and then interestingly, we have cases that are linked from San Diego, from our strain of the hepatitis A, to other parts of California and the country. We have, I know Mr. Walker, you're from Utah. We have a case linked in Utah. We have several cases in Arizona, one case in Colorado, and we have several in other California counties. Santa Cruz has another, proportionately, their outbreak is actually larger than ours. They have, I think, 57 cases. And so they have cases that the first several of their cases were all linked to ours, genetically linked to ours. And then we know that LA, for example, has a case that's epidemiologically linked to ours. We're testing it to see if it's genetically linked to ours. That left a San Diego institution, went there, and then got a couple other people sick in that institution where they went to. And I would also say this shows also the value of the HMIS data. We were able to see in HMIS that that LA person was recently here and seeking services here, and make that, and close that story loop. And so that was very helpful, and I just thank you all for putting the data in HMIS, because we do use it. And also when we see that there's a new case, we go see it and see, where were they recently? Were they recently in a place at a time where we can vaccinate individuals at that location and try to prevent them from getting the illness? So thank you for putting the data in. Next slide. This is our epidemiology curve, and you see that we got a case in November, and then we got, dribs and drabs, a couple of cases, and it really didn't pick up till late February, early March, which is when we classified this as an outbreak and started our hands-on-deck approach. And it's continuing to happen. That drop-off at the end is really just because of, we get the reporting sometimes a little delayed, but there's no indication that it's slowing down, and it seems to be kind of plateaued and maybe slightly going up, but we think it's plateaued right now. So this is, you're familiar with these data. This is the point-in-time count data on this map, and you see where the hot spots of where the homeless individuals, were counted. Now, in the next slide, we overlay with, our cases so far, and the caveat is that not all the cases are mappable because some information is lacking, some of them are unknown, like I said, but of the cases we could map, you can see that there's a strong correlation of where the homeless and the high concentrations of homelessness are and the cases. The hot spots of the cases really are downtown San Diego and El Cajon, and then you see a couple other pockets here and there. So very interesting. Next slide. And what are we doing about it? Like I said, this is an all-hands-on-deck approach. Internally, the many different departments of the county are activated and working on this, and then externally, we're working with many of you, right? And that's why we're here. So we put out several health alerts to alert our medical providers, many news stories. We've established a webpage which has so many different resources that you'll see. And we collectively, in the vaccine side, we've been doing novel things that we've never done before. We've never worked with emergency departments, for example, to do this public health intervention of giving hepatitis A vaccine to these at-risk individuals, right? We know that these populations are less likely to come to our public health immunization centers, so we have to meet them where they are. And offer vaccine where they are. So they're going to the EDs, some folks may be going to the county psych hospital or other psych hospitals around the county, or they may be going to the jails, and now we're routinely vaccinating at intake at the jails. So, we're trying to meet them where they are. We're also sending teams to many of your sites. We've already been to many of your sites, right? And we send folks there to do kind of vaccine clinics at your sites. And if we haven't been to your sites, let me know after this, and we will come to your site. And then we're also going to the substance use providers, disorder providers, and going to their sites. And then lastly, we're doing another novel thing. We're actually going out into the field with our nurses and going to the encampments, with the vaccines and with coolers, and we're going there and offering them on the street. As you know, these populations are vulnerable, and there's a lot of trust issues, and so one, it's hard to find them, but when we do, it's not always easy for them to accept the vaccine, which is why we're also thankful for, we work with some of your organizations. The more because if they trust you, the more you can sell the idea of the vaccine, the easier it makes us to get them to accept it. And then we have homeless outreach workers who help us as well. So yeah, we work closely, and we've given over almost 16,000 doses across the county, And of those, we know that at least 5,800 have been given to the population at risk. It's hard to count some of those exactly. So we're working very closely with environmental health on possible food sources, and so far we have not identified any. They have a sanitation protocol as well that's helpful. And then we investigate many cases, and I already said we've made local recommendations on groups that should be vaccinated in addition to these at-risk populations like your staff. We just made a local recommendation about vaccinating food handlers as well, and that's important. We're going to get the word out later this week. And we're also considering and exploring, just stationing teams of nurses at kind of some of these areas where we know there's a high traffic area of these populations. So, we're in discussion with many of these organizations, but if your organization is not on there and you think that you're high traffic area, talk to me and we'll talk through. We're really trying to get to a place where we can have a systematic approach. We have, for example, House of Metamorphosis. Every week they bring their new clients to a public health center. We have our probation sites all routinely bring them to one of either our tuberculosis clinic or our public health center. And some programs are incorporating into their program goals for each client. So we want to help you help us. So please let us know how we can work together. And this is our new ad campaign that just started. You see it right here. And we have posters available in the back in English and Spanish. And if you want any, also if there's not any after this, just email me and we can get you some. This is now in the trolleys and the bus shelters. And next slide. We also have hygiene kits, so this is not just my lunch. This is hygiene kits. They contain, we know that the best thing to do is to wash your hands with soap and water after using the restroom or before eating. But this is the second best thing, right? Better than nothing. And so this has water, some non-alcohols, hand sanitizer, clean wipes, and information about where to get vaccines. Next slide. Next slide. That's just an example of where we're of a vaccine event that we're doing. And then really the call to action is to educate, immunize, and sanitize. We really need your help in terms of getting the word out, helping people understand why this is important and why they should accept the vaccine. And then and you can take up posters. We have flyers in the back as well. And then really try to get them that long-term protection from the immunization, and including your staff. And then sanitize, we have the hand washing stations, which I appreciate someone mentioned earlier. And we do have a couple out there right now. We're piloting, we're continuing to pilot. We've had mixed results and we're gonna expand that pilot. We actually almost done getting a broad permit from the city of San Diego, which will let us place it in many places. And so if you have a place that you're interested in piloting it, just let me know again and we can talk afterwards. And I think that's everything that we have. So thank you for working with us.
Mr. Chairman, and thank you, because I know you were here in June. But this is not something we've just taken on more recently, and I think there's been a lot of work, and the efforts of collaboration and people onboarding has been terrific. But the public health has taken this on many, many months ago. In fact, I know you've been in March timeframe using media. In your call to action now, and having this great audience here, what do you see more of the immediate? I mean, and I think because you had a number of really good recommendations, so what would you prioritize?
I would say, especially those of you in San Diego Housing Commission, we have a call that Melissa and we're trying to set up for next Tuesday with your leadership to really talk about how do we systematically work this into your operations, that everyone who's walking through your doors can get offered vaccine, and that you can use the disinfection protocols that our environmental health group created. How do we make sure that we're helping protect the people and helping prevent spread? And so those would be my two things. And educate.
Doctor, how long after you give a vaccine does it take for it to become effective? I mean, is there a lag time?
2 weeks.
2 weeks. And then does it last for years?
Yeah, so far, I mean, it's interesting that one kid had vaccination and was not, and still came down with it. But generally speaking, when they do the studies, they show that any people who were vaccinated in 1995-ish still have over 90% protection. So this is not one of those vaccines where after you get the 2-dose series that you need boosters. So far, there's no reason to get a booster. but there's no harm. It's a very, very safe vaccine. We even give it to pregnant women.
And you're encouraging anybody that's working with the homeless or anybody that's at risk for incidental type of contact, and you'll provide the vaccine for them also. So for staff members, for any of the organizations that are out there, as well as for the clients. We'd like to get that number up, maybe double the, do you have enough to double that number?
Yes, yeah, we know that we have a long way to go. We estimate there's about 30,000 of our population at risk between the homeless individuals and the certain kind of more street level drug users. And we think that we have to get about 70% of them to really get what's called herd immunity or community immunity. And so we know that we have a ways to go.
And you got plenty of vaccine on hand?
Well, yeah, we have no shortage of vaccine here locally or state or federally.
Okay.
Doctor, I have a question from some colleagues, or some of our residents don't know if they had the vaccine because, you know, they were in their drug fog or wherever they were. And is there a problem if they got the vaccine again?
No.
Okay.
We do record all of our doses in San Diego Immunization Registry, which is also the beauty of having the immunization registry, so that we can, if we are able to check before, then we can prevent extra doses. But if someone doesn't know and we don't have documentation of them, then one, they can call us and we can tell them if they're in our registry. But if not, there's no harm.
Okay, thank you, sir.
John, you got a question?
Yes. What are the chances that some of this is either coming up from or circulating into and out of Tijuana, since that's where our food service workers live?
I mean, we have no evidence to support that right now, and I say that because we also see the number of hepatitis A cases in Tijuana and California is much lower than ours. Even though if you go to the CDC, it'll tell you to get a Hep A vaccine if you're traveling to Mexico. Really, right now, they should probably be getting a vaccine before coming to San Diego. You know, so but we don't see anything. And so far, in food service workers, whenever there's more than two people report the same location, or if it's a fast food place that we know is somewhere or other restaurants that we know that you know, these populations are more likely to frequent, our environmental health department is working with them, working with the chain level, you know, the higher level folks, to make sure that they are aware of how to sanitize, how to clean, and they do investigate as well. So we have no evidence of this being foodborne.
Isn't tuberculosis more of a concern with the food workers than
it is. It's also a concern. Yeah.
Okay. Any other questions, comments regarding this? Good report. If anybody has, you know, contact with clients or your staff or any other group that you think is at risk, we've got plenty of vaccine. Okay. Thank you.
Thank you.
We'll keep an eye on this. Okay. Item number 6 is a presentation that's going to be provided by Casey. Yes.
Good afternoon. My name is Casey Nguyen. I'm the Director of Housing for Interfaith Community Services, and I'm here on behalf of a group of our colleagues that went to the conference in July. I guess it was a month ago. It seems like it's forever ago. So I'm here to present kind of what the conference was and some of the things that we learned. And so, go to the next slide. So the conference, if any of you have attended, basically there's a bunch of workshops that are presented on best practices.
Casey, let's tell them this is the conference. It's the National Alliance to End Homelessness,
yes.
Right?
Yes, sorry.
Okay,
sorry.
Let's inform them so they know what you were doing.
Okay. Sorry, yes, that's the conference we attended. And also it was an opportunity to meet with our colleagues nationwide, to hear best practices, and also to network with other communities. And also the conference organized a day on the Hill to advocate for 4 things, and I just wanted to share with you what it was. It was to increase funding for HUD housing programs for fiscal year 18, to protect Medicaid funding, to fund affordable housing to at least maintain or increase capacity, and also to preserve and fully fund the U.S. Interagency Council on Homelessness. So a lot of us in San Diego participated in that advocacy day. So I wanted to highlight the organizations that were there, because many of us were. We had folks from Funders Together to End Homelessness, Father Joe's, Catholic Charities, Interfaith, San Diego Housing Commission, the county, BFT Equity Partners, Veterans Village of San Diego, and LaSalle Development. And there may have been others there, and I apologize if I didn't see you. But there was really good representation from San Diego, so it was very exciting. So one of the highlights of the conference was that we got a visit from HUD Secretary Ben Carson, and he gave the keynote address at the luncheon, and one of the things that he did support and say is that he was very solid in his support of housing first strategies, and he also cited the need for data-driven strategies for alternative housing strategies, or when considering alternative housing strategies. And you can see there, and I apologize, I made it so small, but he did say, this is a quote, "A man will not beat addiction from a gutter, he will not get psychiatric help underneath a bridge, and he will not find a steady job without a steady address." So I think most of us were impressed, at least those were the highlights from the speech. So in attending all the different sessions, we were able to reflect on, like I said, everyone was sharing their best practices. And so we were able to reflect on what we're doing well in San Diego. So I just wanted to highlight, pat ourselves on the back a little bit on the things that we are doing well. We have a diverse governance board of leaders in the community. We have landlord engagement groups that are looking for housing. Our coordinated entry system is built into HMIS. We have the collaboration between our organizations has tremendously improved. We have a veterans by name list. We have recognized the importance of creating a regional homeless crisis system, which Greg talked about earlier and is going to be outlined in our upcoming community plan. We've hired focus strategies to write that plan, the merging of RTFH with the COC, and of course the involvement of the COC from both public and private funders. So that was exciting to see that we're already doing a lot of the best practices that are out there in the nationwide. So the next few slides talk about some of the things that maybe we could consider, things that we could bring back to our community. And it sounds like from earlier in the meeting there was a lot of discussion about other research and visiting different sites. And so the good news is a lot of us are already looking into other strategies and always looking for better ways to improve. So around our coordinated entry system, we heard a lot that a lot of communities are struggling. So it's not something that anybody's just magically implemented and it's going perfect. So many sites or communities, COCs, are struggling to implement CES fully. In COCs where there have been major changes or impact on their numbers, there's a few things that are happening. CES is the driving force. It's leading and not policing. It has a flexible fund to pay things like back rent, transportation, and also for rapid rehousing programs for youth, they have a mobile advocate to help facilitate communication with landlords and to help secure their success in their housing. And also there was a lot of talk also about HUD's new guidance and CES toolkit, so definitely might be something we want to look into, with the message being to simplify what we're doing. For programs and services, some of the best practices we heard about, a lot of them were related to creating a crisis response system. And it's clear that shelters are the first access point for most clients. So possibly improving our support to shelters to better equip them to provide more diversion, fully implement housing first principles, and to support clients in gathering their documentation because they are such a important component of the overall system. Also, we have to build a strong relationship with our faith-based shelters. They have the same values that we do, high value on relationships, that all people should be helped, practice hospitality and charity, and they work for peace and justice, which aligns with our values as well. And also, another thing that was talked about at length is that we should make shelters so comfortable with many services and amenities that are better than they can provide on their own. So I think the message was that services should be referred out, and not everything should be take place at the shelter. Continuing on for programs, and Greg mentioned this earlier, that we need more diversion. Also, some COCs are implementing shared housing or roommate matching initiatives to address the overwhelming number of single individuals experiencing homeless. Also, rapid rehousing programs, they acknowledge the need to also work on employment and income generation to be successful. And when working with highly vulnerable populations, it's really important that we maintain low caseloads. So for example, for youth, the recommendation is 1 staff person to every 12 clients, and then for adults with 0 income and rapid rehousing, it would also be 1 to 12. Lots of talk about critical time intervention and eviction prevention, so it's definitely something, and I'm sure a lot of programs are already starting to look at these things, but perhaps looking at it system-wide. And then talking about community and systems, one of the things that generated a lot of interest was there was a session on a ballot measure, and I know Greg's going to talk about that later, so I won't go into that more. Another very interesting session was about addressing encampments and some best practices on how to do that. Speakers advocated for having an organized approach with a dedicated team just to work. A team of 4 that go out for 4 weeks with a goal. And last, there were some bigger system topics that were discussed, and one of them was about race, how and perhaps we should start talking about race in our community, and about women, and perhaps women should be considered their own category or own subpopulation because they have unique needs. Right now they're lumped with men, but they should have their own category like youth and chronic. There was also the idea of publishing project level data to the public with the names of the agencies attached, because this is a way an agency can determine that their data is not in the HMIS system. And also improving educational opportunities for the board and providing opportunities to engage more in discussion and debates around the issue. And more cross-training to bring DV and housing and mental health providers together to kind of reduce the silo effect. Oh, I'm sorry, I have one more.
Thank you, Casey.
I have one more.
Thank you. We're running a lot over.
Oh, okay, I'm okay. You have everything in your slides, so.
Okay, thank you.
Thanks.
I want to get, there's been a lot of discussion going on regarding possible ballot initiatives, and I know that the topic was of significant importance to the ad hoc committee, and Greg thought that we should have some discussion here, and so we put that on the agenda. Greg, you want to kick it off?
Great, thank you, Chair. As Casey mentioned, there was a large delegation from San Diego in DC for the National Conference on Ending Homelessness, and pretty much everyone who was there was at many of the sessions about ballot initiatives to bring in funding for homelessness. A group of us got together in and around those sessions to talk about what it means for our community, and we agreed that it was something that needed to be shared here. And to your point, Chair, the ad hoc committee spent a lot of time talking about this very issue at our last meeting. So just to give a kind of a quick introduction here, we now have a community plan to effectively end homelessness. We agree the plan makes a lot of sense. We agree the difficulty is going to be in implementing that plan. We know we do not have enough resources to help everyone who is on the streets right now. We also know from our most recent point-in-time count that chronic homelessness has increased more than 60% from 2016 to 2017. We also know that the most effective intervention for those who are experiencing chronic homelessness is permanent supportive housing. The most difficult part of creating permanent supportive housing is that permanent supportive housing is 2 things: it's affordable housing and supportive services. There's a lot of affordable housing being developed. Not enough, we need more. But there is not nearly enough supportive services to create truly permanent supportive housing, which is needed for many of the people suffering on our streets right now. In order to bring more permanent supportive housing online, we need the largest dedicated funding stream we can possibly secure for homeless services. Now, other communities have done this effectively. LA County, LA City, Santa Clara County all passed homeless initiatives in 2016. There were a couple key elements in those. They had strong unified leadership talked about how this group is positioned to provide that, has been providing that in several ways. They had a clear statement of both the need and the solutions. Phase 2 of our community plan will identify exactly how much permanent supportive housing we need. And there was no organized opposition. Where in California, these ballot measures will require, as we know, 2/3 voter approval. If there is organized opposition, it will fail. So that means you need everybody at the table. And as I look around our many tables here, there are many tables because there are many seats, we have most of those groups sitting here. So our group who started talking about this wanted to bring it forward to the board and ask our board to take up the leadership that is needed to bring the community together around a cohesive strategy for the upcoming 2018 election and ballot measure or measures that can secure the largest dedicated funding stream to help our neighbors experiencing homelessness. There are other conversations happening. There are other groups already beginning to put forward some pretty particular plans. Many of them are focused on affordable housing, which is great. But affordable housing will not solve our problem. We need permanent supportive housing. So this group needs to make it known that if we cannot secure the supportive services dollars and the flexible funding that's needed, we will not be successful, and we will only have one shot at this. If we pass an initiative in one large part of the community, we likely will not pass another one unless it is significantly different. So I'm here today to ask this board to talk about how you all would like to be a part of this and how you think the Regional Task Force as an organization can take up a leadership role in this unique time and place to help our neighbors experiencing homelessness.
Wow. Okay, great, thank you. One of the things, and we'll make sure everybody has a copy of this, is our policy and process of something like this. So we're not at the point where we're jumping into anything yet. And we'll work with people, but there's an adopted board policy as to how we proceed and something like this. So we'll make sure we remind everybody what that is. And as we proceed, we'll see what opportunities there are. Okay? Any other questions? John?
So I was present at the meeting, and I think we had probably 10 or 15 of us there, and I think it just came from the standpoint of this group and looking at how we can make a difference. And I think when we looked at the board, and I think a lot of the comments that come from the community about what this group stands for and the pressing need is where I think this conversation came up and why we wanted to bring it here to make sure that it was present.
Okay. Sloan?
Yes, here to everything you said, Greg. And just to note, at the state level, we're expecting the vote to happen next week. And so if there's any ability to share to this group some of the advocacy messages and the folks to tweet, send emails to, because this SB2, it will likely be considered next week.
Okay. Okay, any further comments? Go ahead.
Thank you, Chair, and thank you, Greg, for bringing this, and everybody else at the ad hoc committee, and as expressing some support for additional revenue. I think we all agree that we certainly need it, and we could use it well, and we would apply it well. And I wanted to just kind of lay that out there, that I think while this is, I think, the beginning of discussion for what kind of a role the RTFH can play for that. I know we have players within the city of San Diego that are exploring opportunities for hopefully not just affordable housing, but those that also maybe have some set aside and serve for permanent supportive housing opportunities. I know there are some that are within the county that are looking with existing funds, but also what's possible on the horizon. And with all these moving pieces, we certainly have to do so in a way that's coordinated and makes the most sense, because it's very, very difficult to get certain measures passed with an electorate, especially where a 2/3 vote threshold is required, and especially if we're looking at something county-wide. I know that Chair Roberts had also alluded to our policy, and so for those that might want to see more of a discussion on this today, one thing that came to my mind is the very careful nature that we have as a 501c3. To be able to handle matters of that ultimately would become political in nature and be qualified for a ballot, to do so in a way that protects our status as a tax-exempt organization. So it's something that I know that we can explore through our adopted policy and through committee action, and I know that I'm pretty sure everybody in this governance board is interested in exploring this correctly and certainly wants to make a difference in the 2018 timeframe. So thanks again for bringing this up, and I look forward to working with you and everybody else to try to get the most successful measure that we can before the voters and really advocate as an individual, as a council member, to my fullest extent for the additional support from San Diegans.
Just briefly, I just wanted to say thank you again, Greg, for picking this up, and we fully support everything you're saying, everything that's been said so far. I just would urge us to please, and I appreciate the policy, I think it's important that we do this very carefully, but I hope that we move quickly. These kinds of things take a lot of time to move forward on, and if we're going to try to get the unity that we need ultimately as a county, there are other groups that are moving forward, as Greg mentioned, and they're not necessarily including homelessness in what they're thinking about, and this is a one-shot thing. So I would just encourage that we move this sooner rather than later. So thank you.
Okay, any further comments? With that, we've completed the agenda.
So I guess my question is, between now and the next meeting, should a group of us get together? Because I don't know enough about the world of moving forward ballot initiatives, but in any way that we can provide support as a board, I'd be interested. I think this is kind of a time to show real leadership from our standpoint. So anything we can do to help.
We were involved in all three of those initiatives in Santa Clara and the city of LA and the county of LA. I think there's, well, first of all, it's all about the need. That's why these measures happen, because people are just tired of homelessness in their neighborhoods. And as long as you keep that as the message, it works, even a 2/3 vote. The second is that the political leadership really stood up and said we're for it. However, there was a real grassroots effort that was not part of the political leadership or even maybe even this task force. It was just the agencies and the stakeholders, the business community, United Way. They just really stepped up to the plate. And so I think, you know, we as a group here could kind of say we like this idea and it's a good thing, but I think we need to have a real grassroots kind of behind the scenes effort. So I don't think we need to like vote on that. I think it just means getting people together and getting it going. But I do think this group needs to at least formally say this is something that we support. And our agency was very involved. We spent a lot of money in all three of those initiatives, and my board was very concerned about our 501c3. So we had a lawyer kind of look into it, and it's just a matter, as long as you're not putting a lot of time and resources into it, you know, you can do some stuff.
Yeah, and we'll consult with our lawyers also, because it's pretty clear in the policy that there's a warning in there. And I don't want to do anything to jeopardize.
There is something, thank you, Karen. There is something you can do now. San Diego Housing Federation has been doing a lot of the background work on trying to get a bond referendum of whatever sort set up next year. And as Ron and Chris have indicated, there's some things that we public sector types, whether elected or appointed, cannot do without either getting ourselves in trouble or screwing the whole deal. But there are some other, to use a highly technical term, but there are other things that advocacy groups can do. So what I would recommend, I'd be glad to, if you all tell me who the leader, informal ad hoc leader might be, I'll connect you with Steve Russell, who runs the Housing Federation. That might be a good way to get an idea of how you start putting this stuff together, and maybe be a support to them or an adjunct or whatever.
And we have spoken to him. I was hoping that this group would agree this is something we need to take up a leadership role on. And I understand there are issues and things we need to be careful of. But if this group doesn't step forward and say we need to make sure that the right initiative happens in the best way for people, our constituents who are on the streets right now, if we don't step forward and do that, then I'm not sure why we're here.
I understand that. I think the worst thing we can do is shoot ourselves in the foot. And so what I would recommend, and I don't think that anything would be lost by letting the leadership check the legal mechanics of this, and maybe if it's appropriate, addressing in September.
Yeah, and we can do that. Right. Yeah, we're not going to be acting on anything today. Okay. With that, I think we've completed all the items on the agenda, although we couldn't act on a lot of them. We'll make sure that the necessary things are back here before us, and the request to have some additional other items added to the agenda. We'll see that that's done. So I want to thank everybody for being here, and we are now adjourned. Yeah.